Hey everyone, and welcome back to RxIntern, a new podcast series brought to you by the MyPSA Advocacy Office. This series is all about guiding and inspiring pharmacy students as they get ready for their internship journeys. Today, we'll be diving into episode 2 of our series, where we're zooming in on community pharmacy. I'm your host for today, Sydney, and we're going to go behind the scenes of community pharmacy with a very special guest, Miss Danussha, a former community pharmacy intern who's here to share what's really like behind the counter. We'll be chatting about the fast-paced world of community pharmacy, from the day-to-day hustle to the meaningful moments that make it all worthwhile. We'll also be talking about the application process, bust some common myths, and hopefully leave you feeling a little more confident as you prepare for your own internship. So, whether you're a pharmacy student, a healthcare enthusiast, or just curious about what really goes on at your neighborhood pharmacy, stick around. You're in for some great insights. So, a great welcome to Miss Danussha. Thank you so much for joining us today. Now, to start off, could you just start by telling us a little bit about yourself and share a bit about your pharmacy career so far?
All right. Hi. Thank you so much, Sydney. Hi, everyone. I'm Danussha here. I'm from IMU. I just completed my degree on March 2025, and I'm currently waiting for my PRP placement. So I will just share a little bit on my pharmacy career so far. So I chose pharmacy as I've always been keen to know how medicine works in general. So I personally just find it very interesting. And I would say the main skill that I've developed in the past 4 years of my degree would definitely be communication. As we all know that communication is very, very important in healthcare settings, as we need to liaise with multiple different healthcare workers such as doctors, nurses, dietitians, and etc. So I would say communication is a skill that I've developed in the past 4 years. And just to summarize that, my area of interest would definitely be community and clinical settings, as I love interacting with patients. So my future plan was definitely to be a clinical pharmacist first, and then in the future, probably in like 10 years down the road, I will definitely be a community pharmacist.
I see. Thank you so much for that wonderful introduction. It's always really inspiring to hear like how each pharmacist's journeys begins and evolves over time. So,
Yeah.
moving on, we'd like to ask you what inspired you to pursue a career in pharmacy and how did you choose your internship setting?
All right. So I'll answer the first question first. So what inspired me to do my career in pharmacy was definitely my passion for just healthcare people. As I said earlier, that my interest in how medicine works and their impact on health was definitely one of the main reason why I chose to pursue a career in pharmacy. So back in high school, I still remember when I was 13 years old, when you first get into high school, and the first question your teacher asks you is, "What do you want to do when you grow up?" So while all my other friends were saying that they want to become a doctor, engineer, dentist, I just chose to say pharmacy because I just find it so interesting to see how medication works. So here I am, like so many years after actually pursuing my degree in pharmacy. So I was also very fascinated with chemistry in back in high school. I know many people say like, oh, chemistry is pharmacy, and I definitely did experience that in my past 4 years. And a personal experience that really sparked my interest was when I had a fever. This is like very, very long back. I just realized how after taking just a very tiny tablet, felt you just feel completely better. It just amazed me how something so small could have such a powerful effect on your body. So I'm moving on to the second question, which was, how did you choose your internship setting? So in IMU, we were fortunate to be exposed to all three main internship settings. So we were sent for industrial training, hospital training, and as well as community pharmacy. So I personally chose to do my internship at Health Lane Family Pharmacy, as it was conveniently very close to my house. More importantly, I was particularly drawn to the community pharmacy setting because of the direct patient interaction it offers. As I said, I really love interacting with patients. And I was also very eager to improve my communication and counseling skills, especially when it comes to explaining medications to patients from various backgrounds. As we are very, very, as we were told back in pharmacy that we should be learning how to use layman terms, because everything that we learn in degree is very um, healthcare setting wise. So in community pharmacy is definitely more into layman terms. So community pharmacy also provides the real-time exposure to common health issues, OTC, which is over-the-counter recommendations, as well as minor ailment management such as fever, flu, cough, which I find it very practical and rewarding. So Healthline Family Pharmacy also had a good reputation for mentoring students, as my seniors were also as my seniors also did their internship in healthcare in Healthline Family Pharmacy. So offering hands-on experience in key areas like dispensing, stock management, screenings were all done in Healthline Family Pharmacy. And during my time there, I had the opportunity to observe and assist with chronic conditions, also such as hypertension and diabetes. So overall, I felt that this internship setting definitely did give me a strong foundation in understanding patient behavior, pharmaceutical care, and most importantly, customer service, all of which are very essential qualities for becoming a very well-rounded pharmacist.
Thank you so much for sharing that. I think it was really lovely to hear about how your interest in medications evolved over time and also your passion to actually like consult patients and like, get to know them and communicate well. It's really nice to see how these, shape your pivotal decisions into pharmacy. So now that we've covered that, we're going to go into your internship experiences and challenges. So let's talk about your first day. What was it like? Any memorable first impressions?
All right. My first day was definitely a mix of excitement and nervousness as I'm stepping into a real pharmacy setting. Because my community pharmacy placement was the last in the three settings. So in industry, we definitely didn't get patient interaction. In hospital, we did, but definitely not as much as we would experience in a community pharmacy. So I was definitely nervous for that. But on my first day, I was very warmly welcomed by the pharmacists and staff. It made me very, very comfortable and included. Although my placement was only for 2 weeks, I felt really, really welcomed in their pharmacy. And my first impression was definitely how fast and organized the pharmacy. As we know that community pharmacy has to work in a very fast pace, as patients are just coming in and out very frequently. So I was also surprised by how many patients they come in not just to get their medications or their supplies, they come in just to seek advice. There are patients who just come in and ask like, oh, I have this issue. What do you think I should do about it? There are patients who just come in to just, especially the older patients who just want to come in and they just want to talk to somebody. So they find it very comfortable to do it with a pharmacist. And I also observed how efficiently the pharmacists multitask, because it's not easy to be doing multiple jobs at one time. So like they were dispensing, they were advising, they were also managing the inventory, the cashier, the billing. So it was definitely a lot on the first day to see, but it definitely inspired me and got me so eager to learn and contribute more. Yeah.
Wow, I think it's really reassuring to hear that there's such a warm and welcoming environment waiting for us at the community pharmacy. And so, really, thank you for sharing that. It's such a real peek into what students can expect when they step into the pharmacy for the first time, especially the whole fast-paced environment thing. I'm sure it can be a bit overwhelming.
Yeah.
So, thank you for sharing. So, our next question for you is, what are some of the key responsibilities of a pharmacy intern in a community setting?
All right, so the key responsibilities of a pharmacy intern would be definitely the first thing would be assisting in dispensing medications, but it should be done under supervision as we are still a student, not a pharmacist yet. Other than that would be counseling patients on proper medication use, the side effect and storage, especially for medications such as insulin, and handling over the counter recommendations for minor ailments. So there are like, as we know, there are like multiple different cough mixtures, multiple different flu medication, cough, fever. So that is definitely something that we will need to know. And more than that would be managing inventory. So we definitely have to check its expiry dates, restocking the shelves, helping with health screenings such as blood pressure and glucose tests. Um, Patients do come in very frequently for blood pressure and glucose tests check because they don't have the machines at home. So they just come to the pharmacy and they just get it done. And but then it's not really important, or like not really how to say, they don't really encourage us to use the pharmacy system, especially in the billing side, because we are only there for a very short amount of time. So we don't really get to do that. But then we do everything else, such as prescription screening, data entry of the for substances and stuff like that, and also observing how the pharmacies handles patient queries and interactions. I would say I did learn a lot by just observing how the pharmacies handle and like talk to the patient. Is definitely something for us to is definitely one of our responsibility as a pharmacy intern.
I see. That's really helpful to hear and know. I think a lot of students wonder like what they'll actually do on the job. So it's really great to hear that interns are actually very involved. And it sounds like there's a really good mix of learning and also hands-on experience. So moving on, our next question for you is, what were some of the biggest challenges you faced as an intern, and how did you overcome them?
Okay, so my biggest challenge as an intern was definitely the lack of confidence when I had to counsel patients. So as we know that the pharmacy, especially community pharmacy, runs in a very fast-paced, very fast-paced. So you can't always rely on the pharmacies to be there with you 24/7 to be helping you out. So that was something that I learned. I definitely did overcome it by observing the pharmacies on duty, and then I started practicing it with all the other staffs. So we would just create scenarios where like the staffs just come and then they like ask you questions on like for example, they just come in and say, oh, they have a runny nose or they have a blocked nose, and then you just recommend OTC medications to them. So that is definitely one way that we need to overcome my lack of confidence. Second one would be language barriers with patients. So as I said, that we really need to use layman terms. I overcome it. I learned how to use more layman terms and sometimes basic phrases in other languages. Time management during busy hours was also one of the biggest challenge, and I improved that by prioritizing the task and staying organized, and definitely asking questions when I really needed the help. Um, the other challenge that I faced was trying to remember drug names and its doses. So back in my university during the 4 years, we weren't really told to memorize the doses during the first 3 years. So when I was in my final year and we went to a community pharmacy, having to know all the doses was definitely a lot to me. But what I did was whenever I had the free time, I just randomly go through the drugs and look through its doses so that I get more familiar with it. Other than that would be identifying medications based on their descriptions. For an example, some patients would just come to you and say things like the white tablet I took last time, which made it very difficult because as we know, there are a lot of white tablets. So thankfully, the pharmacy, Healthlane Family Pharmacy had a patient record system. So we definitely went back to their past prescriptions, and then we accurately identified the medication. The Last but most important challenge was definitely the real life pace versus classroom learning. So I just adapted by staying calm and asking questions when I was unsure.
See, thank you for being honest and sharing. I think it's always reassuring to hear that the challenges are part of the process, but there are also chances to grow and learn. And it's very clear that you came out of it more confident and a better pharmacist. So, moving on, could you tell us about the most invaluable skills you gained during your internship?
All right. So the most valuable skill that I would definitely emphasize on is definitely communication. So, like I said, communication was a skill that I developed in the past 4 years. Patient counseling and communication is very, very important as we need to know how to explain medications clearly and effectively. Uh, for example, a side effect or when you should take it, whether is it after food, before food, all of that are very, very important. So communication skill is very, very important, and I would say it's the most valuable skill that I've gained. Next would be active listening. So we should learn how to understand patient concerns and needs, even when they are not very clear in expressing how they feel. Next would be dispensing accuracy. So we should definitely double check, triple check medications and prescriptions to avoid errors, as there are a lot of medications that sound alike, look alike. So we definitely have to recheck medications. And if possible, if your supervisors are free, just ask them to help you check. But since we are an intern, then they would definitely expect us to show it to them first before they dispense the medications. Next skill would definitely be time management. So we should definitely prioritize tasks, especially during peak hours. So during my internship, we were given a set of things to complete and achieve and get signature from the preceptor. So I would say prioritizing the task and making sure you do your particular job when it's non-peak hour definitely is a skill that you have to learn. And moreover, it's problem solving, especially when patient just comes with incomplete information on unusual requests, like I said, the white paper just now. Other than that would just be professionalism, teamwork, and yeah, I think that's it.
Hey, thank you for sharing. These are very solid takeaways. I think we often forget that not just the technical skills, but it's actually these soft skills that actually shaped us into like a better pharmacist. So it's really great to hear like how this internship has helped you in different ways. So moving on, we'd like to ask you, what were there any mentors that had a significant impact on you during your internship?
Yes, I I had a very, very significant impact on me from my pharmacies as well as the branch manager. So they were really, really, really approachable, very willing to teach and explain things in detail. So they asked them for like the smallest help. They would definitely, always willing to help and like teach me, even though it's like probably something they feel like it's so unusual for a student to ask, but they don't judge you. They're just willing to explain and teach you very patiently. They also encouraged me to step out of my comfort zone and handle real patient interactions. So if let's say um, a patient just comes up and then they see like it's a very unusual case or something more critical, they would definitely just try to include me so that I step out of my comfort zone and I get to learn more, as I only had very limited time in the community pharmacy. I also appreciated how they emphasized not just the technical side, but also empathy and professionalism. Their support definitely gave me the confidence to grow both personally and professionally. And till up to this day, my pharmacist would just sometimes just text me to check on me because right after my placement, I had my finals for my pharmacy degree itself. So she would always check up on me, making sure I'm okay. So I'm very, very grateful for the both of them.
I think that's really lovely to hear. I think having somebody or a figure in your life who believes in you and takes the time to guide you will just makes a lot of difference. It's really like heartwarming to hear like how this mentorship has shaped your experience. So our next question for you is, what is one piece of advice that you received during your internship that you still carry with you today?
The one piece of advice that I received from my preceptor itself was not to be afraid to ask questions. It's better to ask than to assume when it comes to patient safety. Because you can't just assume anything when it comes to medications, as it can cause a lot of medication errors. So this advice stuck with me because it reminded me that learning is ongoing and it's okay to seek help. We were only students in our fourth year. We have a lot more to learn. So it definitely did help me overcome the fear of making mistakes and focus on being more careful and accurate. It also reminded me that pharmacies play a very, very critical role in ensuring safe and effective medication use. And that definitely starts with a clear communication and a willingness to learn.
Thank you for sharing that. It's a very powerful reminder. I think we often forget to ask for help or, communicate. So sometimes it's really the simplest advice that sticks to us the longest. So I'm sure it'll resonate with a lot of students listening in as well. Now, moving on, we'd like to talk about more about the community disciplinary collaboration. So, could you just walk us through the medication dispensing process in a community setting? What were the key steps to ensure patient safety and accuracy?
All right. So the medication dispensing process usually starts with the prescription review. So we check for the completeness, such as drug name, dose, frequency, duration, and the prescriber info. And then we will evaluate for any sort of drug interactions or duplications, any allergies, and whether or not it's appropriate for the patient, especially in elderly and pediatric cases. Next would be inputting the prescription details into the pharmacy system accurately and to also generate correct labels with clear instructions for the patient. So we should definitely select the correct medication and then we should double check with the label and prescription. So the medication, label, and prescription, all three should be double check, if can triple check. And then the final check by the pharmacist would be where the pharmacist on duty would verify all the details before they hand it over to the patients. Other than that would be explaining dosage, timing, side effects, storage, and address any concerns. For documentation wise, it's usually they record and update the patient's profile for future references. So when they come back and get back, if they want to get back their medication that they've already bought before, we already have it in our system. And the last would be for key safety practices, usually it's just double checking, triple checking, using the barcode scanning where each medication has their own barcode. So we will always double check on that. And also maintaining the patient and making sure they're up to date.
I see. I think this is a very important process to understand. And it sounds like there's a lot of attention to detail at every step, which is very reassuring for anyone stepping into this kind of environment. So thank you so much for breaking all of this down for us. So moving on, our next question for you is, what is your experience with managing high-risk medications in a community pharmacy setting? How did you ensure patient safety and proper medication use?
All right. So exposure to high-risk medications such as insulin and controlled substances, we always practice double checking the doses and instructions very carefully. So if let's say the medication has an auxiliary warning such as take with food, may cause drowsiness, we ensure that we stick the special stickers and also explain to the patients multiple times. And we also provide detailed counseling to emphasize on the adherence and monitoring. So if let's say the patient is on insulin, then we will definitely ask the patient to measure their SMBG at home frequently. And other than that would be educating patients on the storage and administration techniques, especially for insulin pens or inhalers. So as an example, for inhalers, you're supposed to carry with you at all times. Insulin, if I say it's like newly opened, then it should be not kept in the fridge. If it's not open, then it should be in the fridge, stuff like that. And involving the pharmacies for any dose clarification or red flags in the prescription. So usually, if it's a high-risk medications, the pharmacies would definitely be involved. So they will clarify any dose or red flags in the prescription. And we usually learn to follow standard operating procedures such as and refer to resources such as memes, CPG guidelines, and etc. Yeah.
Thank you. I think managing high-risk meds is definitely no easy task.
Yeah.
There's definitely a lot of responsibility in ensuring the patients get the correct information and guidance. Thank you so much for explaining everything for us. So our next question for you is, what is your experience like working with doctors, nurses, or other healthcare professionals in a community setting?
All right. So in a community setting, we have very limited direct interaction with doctors and nurses, but we did communicate occasionally. So when I was doing my internship in community pharmacy for around 2 weeks, I had one patient who came in with a prescription, and it was not clear at all, but it was a prescription from a hospital nearby. So we tried to call the doctor. We tried to get back. We tried to get in contact with the doctor, but definitely it's a bit of a challenge because we are not part of the hospital. So it's definitely some. If let's say you're in a hospital and you just get a call from a random number, usually the doctors will not pick up. But then what we did was we called the reception, and we told the reception that, oh, we are from this pharmacy, and it's about this patient. We would like to speak to a particular doctor. And I think by end of the day, we did get back the correct prescription. And then we also had to call clinics sometimes to clarify prescriptions or resolve drug-related issues. I also did observe the pharmacies coordinating with the nearby clinics to ensure the continuity of the care for patients. So I did learn the importance of interprofessional communication to prevent medication errors and ensure safe dispensing. I definitely did appreciate the role of pharmacists as a bridge between the patients and and the healthcare providers.
Thank you for sharing that. It's really interesting to hear how pharmacists and other healthcare professionals communicate. I think that, teamwork is a very big part of the role, and it really reinforces the idea that patient care is a group effort. And I'm sure this experience have made you feel more connected to the healthcare process.
Yeah.
So our next question for you here is, did you get to when you did your health screening procedures, what was that experience like?
All right. I assisted with basic healthcare screening such as blood pressure check and also blood glucose check. I learned how to use the screening devices properly and interpret the readings. So it took me a while to get the confidence in explaining the results, or even to operate the machines on my own. I definitely did, in the end of the day, I definitely did gain the confidence to explain the results to the patients, and I did advise when to seek further medical help. I also found it very rewarding to provide preventive care and early detection support to the community. So it did help me understand the importance of holistic care, not just dispensing, but also promoting overall health.
I see. It must have been very rewarding, a very rewarding part of your internship since you get to directly interact with your patients there. I think it's really nice to hear how pharmacy interns get involved with screening and prevention.
Yeah.
It's clear that community pharmacy is much more than just dispensing medications, and
Yeah.
it's more about helping overall health. Yeah. So next up, our next question for you is, can you share a memorable patient case where you felt like you play a meaningful role?
All right. I would just emphasize on the patient that I spoke about earlier, where they came in for a white tablet. So it was a regular elderly patient who came in asking for a white tablet for pressure, but they couldn't remember the name. So instead of guessing and assuming, I used the patient record system to just trace back her previous prescriptions. And then I discovered she was actually on amlodipine. So amlodipine is definitely a medication for high blood pressure. So I confirmed the medication, double checked with the pharmacist, and I also counseled her on the proper use and timing. So she also shared that she often forgets when whether she has taken her medication or not. which definitely would affect her blood pressure. And on that day, her blood pressure was higher than normal, as what she said. So I suggested using a pill organizer, as she is also a diabetic patient. So I suggested to use a pill organizer. And she came in with her child. So I told the child to, like, set a reminder on the child's phone, so that the child could tell the mom when she could take her medications. And this is just to manage her medications better. And then 1 week later, on my last day, I saw her back. She returned and thanked us, as she said she felt more confident, and she had fewer missed doses, as the day before she went to the hospital, and then the doctor said that her blood pressure is now well controlled. And this experience made me realize that the impact of good communication, patient education, and follow-up in the community pharmacies.
Thank you so much for sharing that. That was we got to really connect and communicate, and they were here because of you. Thank you so much.
Thank
All right,
you.
I think this wraps up our last question. Thank you so much, Ms. Danussha, for your wonderful sharing of your internship experience in the community pharmacy sector. I believe that everyone listening right now have gained valuable insight on pharmacy internships in this sector. And with
Thank you
that,
very much, Sydney, and to the fellow team. Thank you very much, and good luck in completing your pharmacy degree soon.
thank you so much. And with that, that concludes today's episode of RX Intern. A huge thanks again to our wonderful speaker, Ms. Danussha, for sharing your experience. If you enjoyed this conversation and want to hear more about the world of pharmacy, be sure to subscribe and follow us on our MyPSA YouTube, Facebook, Instagram, and Spotify. Also, don't forget to join us for the next episode where we will be discussing on the topic of industrial pharmacy interns. Until next time, stay tuned and stay inspired.